My name's Nadia Lafferty and I'm one of the paediatric advisors with OCPA. My colleague Lauren Hiffler works in Dakar, and between us we cover all the paediatric missions in OCPA. I started MSF with OCP, so first of all as a field paediatrician, and then I moved into the PMR role with OCP. After that I became the paediatric implementer with OCPA for a year, and then I've moved into the paediatric advisor position last year. I remember my first mission feeling a bit lost and confused when I got to the field and not really knowing what my role was, and at the same time having this enormous pressure from national staff and expectation of me because I was a paediatrician, I was an expert in the field. Now for me, I felt as though the national staff were much more experienced than me because I had never seen cases like malaria. I had read about them in theory, of course, but I had never seen them in practice, and I didn't know the dose of artesunate to give, for example. Almost everything was new to me in the field. Malaria, malnutrition, tetanus, measles, all of these conditions that simply didn't exist in my daily practice. And I remember feeling very lost and confused, and also having to deal with responsibilities that I wasn't used to dealing with back home. So when patients died, I took sole responsibility for that in the field. In terms of your job in the field, the role of the clinical paediatrician is really clinical. So you're going to be doing ward rounds every day, reviewing children in the OPD, making consultations, reviewing sick children out of hours in the afternoon. You'll have on-call responsibilities. Usually you're on a roster with other doctors. Sometimes you're the only doctor, in which case you'd be on call, but you're unlikely to be called every night. You know, we also want to protect you and make sure that you get enough rest in the field, because it can be a very intense job with a lot of responsibility. It's important that when you make consultations that you do these things in the same way that you do them at home. So you need to document your consultations, your diagnoses, your treatment plans according to MSF protocols and properly in the notes. Other things that are outside of perhaps the purely clinical side, you'll be involved with training of national staff. So you'll have certain staff underneath you, clinical officers, nurses, national doctors sometimes who are not specialists. You'll be involved with training, and usually in OCPA we try to get you to follow our training package. You'll also have some managerial responsibilities, so although your main task will be clinical, you'll need to work hand in hand with the MAM and the PMR with things like monitoring of prescriptions on the ward, drug consumption, use of equipment, perhaps even rosters of the clinical officers and other staff under your responsibility. And you'll help, using all this, you'll help the medical order as well, because you will know best what's happening on the ground within the ward. You'll also have responsibilities in supervision, so you'll be responsible for supervising clinical officers below you and be involved with their personal development plan and their evaluations. Like in any clinical work, you need to work as a team. Teamwork is essential. You can never do things on your own. So you're going to be working with clinical officers, perhaps other doctors, nurses, pharmacists, managers, and auxiliary nurses in the field. And these will be a mixture of expatriate staff and national staff. Sometimes only MSF staff, sometimes also Ministry of Health staff. So your team will be diverse and it will be different in every project. One of the most important things is your relationship with national staff, because whether they're MSF or whether they're MOH, your collaboration with the national staff is extremely important. The majority of the people that you work with are going to be non-expatriate staff, and these are the people who really make up the bulk of your team. The reason it's so important to collaborate with them is because if you want to change anything, adapt anything, improve anything, the people who are going to help you to do that will be the national staff. And you need to have a good relationship with them, and they need to be involved with the ideas and with the improvements in order to make things work. One of the most frustrating things for national staff is the expatriate turnover. If we're changing sometimes every 3 months, maybe every 6 months, at best every 9 months in the field. You can imagine what this is like for national staff who see expatriates come and go and change things and replace things, and it can be very, very frustrating for them to try to adapt to new people who come to the field every few months. So it's important also to maintain some level of consistency. Just communication is such a key thing in your field that you have to communicate with all staff, medical and non-medical. Don't forget that we can't do everything by ourselves. There are a whole team of support behind us, like admins, Watsons, logisticians, that we really need in order for us to do our job. So we need to make sure that we respect all members of the team and that we communicate effectively exactly what we need and go through the correct procedures to order the things that we need from the other departments. I think the key word, and you'll hear this again and again in MSF, is flexibility. Although you're there for a specific reason, anything can change in the field and you kind of need to be prepared for that. Whether it's in your technical capacity as a paediatrician, so perhaps there's going to be an epidemic, an outbreak of measles or a high peak of malnutrition or malaria, these things can happen quite rapidly and you need to be able to adapt and cope with that under pressure. It could also be in a non-technical capacity, so just as a member of the expat team, perhaps the security context changes, perhaps there's a huge influx of refugees from one week to the next, and you need to work together with your expat team to deal with this, to make a plan together, and to be flexible to, like I said before, changes in your profile perhaps you'll need to step outside of your profile to deal with an imminent emergency. The most important thing that you're expected is to work as a team and to support each other. It's very difficult in the field. You're under pressure in all sorts of ways. Things are different, the work is different, the team environment is different, the food is different, the climate is different, and it can be very stressful. But if you work as a team and you communicate well together, you will get through this. So if you work as a team, you'll be able to achieve things together, and that's the most important thing. And I wish you loads of luck with your first mission, and I hope you'll enjoy it as much as possible. Despite all the challenges, it will be such a rewarding experience.